Hello, my name is Querida and I'm a Fleet Street Clinic nurse. The purpose of this video is to help guide you through how to do a PCR swab. With this, we'll be guiding you how to take the sample from your throat and your nose in accordance with Public Health England guidance. In preparation, I suggest that you have a small handheld mirror or you stand near a mirror. You'll need some tissues so you can blow your nose, and also you do need to wash your hands thoroughly before you start the procedure. Now, open the pack containing the swab. There is an arrow on the outside packaging to demonstrate which side to open. Be very careful not to touch the tip so as to not to contaminate your sample. The swab looks a bit like a cotton bud, but actually contains a foamy material. Take the swab out and then, looking in the mirror, open your mouth and swab gently around the area of your tonsils, or if they've been removed, where the tonsils once were. You need to rotate the swab around for about 10 seconds at each site. This may feel uncomfortable, so take your time. Ideally, if you can sweep the roof when changing sides, this will help to ensure adequate secretions have been collected. Do not touch the tongue or teeth at any point, as this could contaminate the sample. The next step is to gently insert the same swab up one nostril, approximately 2.5 centimetres. Be careful to ensure the tip of the swab does not touch any other surfaces when doing this. Rotate the swab gently for approximately 5 seconds and repeat using the other nostril. You now need to safely package the sample ready to send back to the lab for analysis. Whilst holding the swab, again, make sure it does not come in contact with any surfaces. Carefully open the vial that the swab comes with and poke the tip into the vial and break off the end into the vial. There is an indentation on the swab, so the snap should be easy to do. Afterwards, you want to screw the cap on securely so the liquid stays in the vial with no leaking. Your pack will either contain a pre-printed barcode label or a form to collect your details. If you have a label, please check the details are correct and stick the label to the vial. If you have a form, please complete the form clearly. You'll need to return this with your sample so it can be identified at the lab. The next step is to assemble the package ready for sending back to the lab. Place the vial in a small plastic bag, closed securely. Put the white absorbent pad and the small plastic bag containing the vial into the biohazard bag and seal shut. Wipe the biohazard bag with universal clinical wipes. Using the box your home kit arrived in, place the biohazard bag in the box along with your filled out requisition form if you didn't have a barcode label. Seal the box shut. Stick the provided return address label on the box over your address and stick the provided biohazard sticker on the box. Your sample is ready to return to the clinic. Please check your COVID home leaflet's information sheet on how to return the sample. It will depend on the method that you were booked in for.